Transforming your life with hypnotherapy just got easier with your host, Julie from CoachingHypnosis.net.
Welcome back, dear listener, to Coaching Hypnosis. Before we get to the actual manipulation of your reality, we have to talk about safety. If you're using tools to mask a fire that's burning your house down, you're not healing, you're just ignoring the smoke alarm. We are working through the 13 foundational tools of clinical pain management. 1. Direct suggestion. 2. Indirect suggestion. 3. Amnesia. 4. Sensory alteration. 5. Symptom substitution. 6. Symptom displacement. 7. Disassociation. 8. Reinterpretation reframing. 9. Confusion. 10. Gradual dominion. 11. Regression to pre-pain period. 12. Pseudo-orientation in time. 13. Time distortion. Today, we focus on the Band-Aid principle. As Dr. Michael Yapko emphasizes in trance work, pain is a warning sign that something is wrong, and ignoring a warning sign is a special kind of stupidity. Hypnosis is a magnificent tool for turning down the volume of agony, reducing the emotional tax of suffering, and helping you function. But it's not a structural repair kit. It manages the signal. It doesn't solve the underlying pathology. If you are currently working with a hypnotist, here is the reality check you need. Ethical requirement and why it matters. Medical clearance. Hypnosis is a support system, not a diagnostic tool. If they don't ask for a doctor's note, run. No, it's not all in your head. Why it matters. A professional knows pain is a negotiated experience. They won't blame you, and they won't treat it as imaginary. The Band-Aid model. It keeps your nervous system stable while you treat the physical cause. It is the bridge, not the destination. Holistic assessment. They should care about how pain ruins your professional, family and personal life, not just the physical location. Examples of the Band-Aid principle in practice. The chronic back issue. If you have a disc protrusion, hypnosis doesn't fix the disc. It's a Band-Aid that keeps your muscles from spasming in panic, which reduces the secondary pain caused by your own anxiety. Post-surgical recovery. If you are recovering, hypnosis is a Band-Aid for your nervous system to modulate the pain response so you can engage in physical therapy, which is the actual structural healing. The migraine loop. If you have migraines, medication might be the fix, but hypnosis is the Band-Aid that prevents the anticipatory anxiety from triggering the next cycle. If your practitioner tells you that hypnosis alone will heal a structural condition, they are practicing malpractice, not coaching. You are here to gain agency, not to cultivate denial. Tomorrow, we'll finally get our hands dirty. We begin with the work of tool number 1, direct suggestion. We will talk about why the most effective way to change your reality is to stop asking your brain for mercy and to start ordering it to stand down. Thank you for listening to Coaching Hypnosis.